Hi there, good to see you back. Let's continue our discussion one more time, talking about common diseases in dairy cattle in Unit 11. First one leading off this section is the most expensive disease in dairy cattle in the United States, and that is mastitis. Mastitis is caused by an infection or inflammation of the milk secretory tissue inside the mammary gland, and it's always bacterial in nature. It's related to maybe teat end trauma, machine malfunction in the milking parlor, or simple poor environmental conditions. Symptoms of mastitis would include always lower milk production, somewhere between 10 to 15%, all the way up to a huge reduction where they'll be off milk totally, signified by chunks or flakes or maybe blood in the milk. It might be watery, might be a little bit smelly. There's lots of weird things that can happen whenever a mastitis infection sets in. And it can be systemic. You can have animals with a full body fever going on here. Prevention is simply just done with sanitation and good preemptive testing. But this is a contagious type problem that's often transferred in infected milk or transferred with human hands or transferred just by a dirty environment. There's a couple of diseases listed here, and an increase in somatic cell count. So somatic cells are epithelial cells and white blood cells that are discharged to the mammary gland whenever they're fighting this infection, and we can measure that cell shred, what is shedded in the milk, and kind of get a gauge on how much bacterial load is there. Again, it's environmental in nature, caused by a couple of pathogens that are listed here. This one responds very, very well to antibiotic therapy. And so most of the time when we treat it, we're going to go intramammary antibiotics and maybe even additional systemic antibiotics depending on how sick she is. But this is clearly costing us about $200 to $300 a cow in the dairy business a year. And that's whether you have a large problem or not. Bovine respiratory disease complex is the next one that we will chat about, and there's a whole bunch of things that are included here, whether it's BRSV, bovine respiratory syncytial virus, PI3, infectious bovine rhinotracheitis, which is IBR, a number of different diseases here, but they're all respiratory in nature, associated with stress. Shipping fever is kind of often connected to BRDC. Morbidity rates are going to be, if we shipped a group of steers, feeder steers, for example, morbidity rates are probably more than 50% if we have an outbreak of something like this. We may lose 10% of them, but sickness rates are going to be somewhere probably north of 50%. It usually outbreaks within about 5 to 10 days of movement or transition from one place to another, and they'll have fevers greater than 104 typically. So prevent it by reducing stress. Don't double up a lot of different operations. So don't dehorn and castrate and vaccinate all at one time. That's a lot of things going on and may actually trigger this to happen. Vaccinate for it actively, and then keep animals in good nutritional status. Yonos disease is a digestive disorder caused by a pathogen that infects an animal very early on in life, and then really doesn't manifest itself and present itself until about 3 to 5 years of age. So it's very slow growing. It is spread by fecal transmission. So if we get contamination of manure in feed, and another cow or calf comes along and eats that feed, they can become infected. So calves that are less than 6 months of age are usually your highest risk individuals. So keeping that area and that feed clean. We can do a number of different diagnostic tests, and often it's diagnosed with an ELISA test. But you'll see it signified by really persistent, very profuse diarrhea. Cows that eat normally, which is very weird. They'll eat normal, gain, probably lose weight, and then have just consistent profuse diarrhea. So there's not a lot of treatment that you can do here. Just supportive therapy, and you're most likely going to cull these animals. But make sure and don't mix feed with the same utensils that you clean your stalls with. That would be poor practice and high risk of Yonos disease transmission. Next disease on the list is milk fever, also known as hypocalcemia or parturient paresis. This one, the fever part of milk fever is a misnomer because it is non-febrile. They do not have a fever. In fact, they'll be low on body temperature typically. So this is a acute deficiency of calcium in the blood, and sometimes about 6% incidence rate in dairy cattle. So as we get back to talking about milk fever, there's a lot of different things that can go on. It can be very subclinical or very mild, and whether it be hypertensive and weak, and we'll just typically probably administer some oral calcium or maybe some intravenous calcium salts. But as the disease progresses and maybe is associated with low dry matter intakes, ketosis, retained placenta, DAs, now we have to be cautious with our treatment strategy. Those cows that really get more acute probably will be lying down. They'll have cold, droopy ears, and now we definitely need to go with IV calcium. If they get to where they're lying on their side, they can be comatose at that point in time. We clearly have no other recourse but to provide intravenous calcium. The good news is if you get to them early in stage 1 or stage 2, they will probably respond very, very quickly and come out of it relatively quickly, especially if you have supportive therapy afterwards. Next disease we should chat about is ketosis, and ketosis will sometimes be associated with hypocalcemia, and this one is acetonemia or hypoglycemia, so signified by low blood sugar. And so we don't have enough sugar in the diet, don't have enough energy, and so cattle will start to mobilize fat off their back in order to compensate for the lack of energy, and so they'll eventually just run out of that. And so they will be losing weight quickly. You'll have actually an acetone smell on the breath. This one typically occurs within the first few weeks after calving if they're going to have it. Prevent it by adequate crude protein, energy, and mineral vitamin levels in your feeding program. You can use a little bit of propylene glycol, but feed good high-quality feed. And treatment, again, with propylene glycol, IV glucose solutions, and just monitor feed intake. So let's talk tuberculosis. TB is, of course, very chronic and highly, highly infectious, and this is one that you would have to keep your eye on. Now, we're very fortunate in Illinois. We are considered a TB-free state because it's very rare to see it around here. Oftentimes transmitted by deer, but there are locations in the U.S. that are not TB-free zones or states. And so they have to test and sometimes have restricted movement. And there are some states that you must have a TB-free test in order to move cattle in and out of that state. This is airborne, an airborne pathogen, contamination in feed and water. It's rare, but these are respiratory distress type symptoms. And there is no treatment, only slaughter if you happen to detect TB. No vaccination either. So one that is acutely problematic and certainly also a zoonotic disease. Next is tetanus, and I won't spend a whole lot of time on tetanus. We've discussed tetanus in swine, but again, something associated with a deep tissue injury that closes over at the surface pretty quickly, and then that infection kind of manifests itself deep in the tissue and creates a really, really terrible toxin that you would have to treat very aggressively with an antitoxin and antibiotic therapy. There's a number of terrible things that can go along with tetanus. So maintain your facilities well, and hopefully these things won't happen. All right, so that brings us to our final break. So we'll wrap up that. We'll conclude segment 3 here of our mini lecture series of 4 in this Unit 11, Common Cattle Diseases.